Hey, everybody, it's David Kemp. I'm your host of Highway to Health podcast series, and I can't thank you enough for being here today. If you've paid attention or listened to any of the previous episodes, you know what's near and dear to my heart. I love speaking to innovative, disruptive companies and leaders of those companies that are helping provide improved experience, improved access, and of course, improved outcomes for our patient community. And we'll talk today about something that's really important for both the patient community and the provider community. And I'm glad you joined us. I'm really excited to introduce the CEO of Arista MD, Brooke Levasseur, to the show. Brooke, welcome to Highway to Health.
Thanks, David. Really appreciate you having me today.
I can't thank you enough for being here. You're in beautiful, sunny San Diego, and I hope you're having a great day. I bet it's as beautiful as we all think it is.
No complaints. Yeah, it's pretty nice here today.
Well, good to hear. We'll get into business here in a minute. We'll get down to the details, but it's become a tradition for me. It's something that I enjoy learning about from the executives that have been on the show. We're all in the healthcare industry, and so it's part of our responsibility, personal responsibility, to find habits, build habits that help us stay mentally and physically strong and fit in our personal lives and our professional lives, so that we can perform for those around us. Tell us a little bit about the habits that you've built up to maintain, mental and physical stability.
Okay. Let's see. For me, and I've struggled with this my whole life, but every year I recommit to improving my sleep. I think sleep is just the number one building block. So that's an ongoing struggle for me. But, I try and set up good routines for myself so that I'm getting solid sleep, uninterrupted sleep, which is hard, but that's a focus. And then I don't know, just for stress relief and all the other benefits, I'm really into athletic activities. Being in San Diego, I'm lucky. We get outside a ton. So I try and be outside, take walks. My whole family is into surfing. So they're trying to teach me, which is really embarrassing to take up surfing in your 40s. But I'm trying. So yeah, I do that. And I kick off every day with a workout. I mean, it's kind of like I can't get started until I've had a good sweat in. And I find that helps me stay sane and stay focused, and a lot of great benefits. I'm a total endorphin junkie at this point. So I think it's sleep plus a good early morning workout.
And they go hand in hand.
Yeah.
If you're not sleeping well, it's hard to have the energy to work out. And if you didn't say surfing living in San Diego, I'd ask you about it.
Right. I had to pick it up when we moved here. It was like, check the box when you get a place in San Diego.
Yeah, you have to. I've never been surfing, but I'll have to try it sometime. On the sleep point that you made, even Elon Musk, who, take politics out of it, he's got to be one of the busiest humans on the planet with all that he is involved with. He gets 6.5 hours of sleep every night, and that's a requirement for him. He's done the analysis. He knows that he's not as productive if he doesn't get that amount of sleep. So if he can find 6.5 hours of sleep every night, I think we should be able to.
Exactly. We all need to be doing it.
Yeah.
Yeah. It's important.
Exactly. Well, I appreciate you sharing those things with us. And, I think hearing from executives like yourself, the stories of Elon Musk and others, if we can see the people in our, that are living really busy lives and have really important things on their plate, still able to instill and build habits that maintain their physical and mental health, I think that should inspire all of us to implement some sort of strategy. So thanks for sharing. Let's talk about healthcare a little bit. Are you okay with that?
I love it. My favorite topic. Let's do it.
Mine too. So, we'll get into Arista MD, but we'll start just, with some of the things that we're all seeing in healthcare right now. Our healthcare professionals are facing a lot of challenges right now. We hear more and more about physician burnout, understaffing, and the other concerns that these physicians are facing. Being in the technology space, in the services space, how have you seen, just at a macro level, how have you seen technology play a role in alleviating some of these concerns and providing some benefit, some aid to our physicians so that they can, provide the right level, the highest level of care for our patient community.
Yeah. Well, I think unfortunately technology has played a role in why we're experiencing such high rates of burnout. And I don't need to retell that story. I think we all know what happened with EHRs coming online and how hard that's been on providers. But the fact is, providers are spending hours on work they never went to school for. This is not what they trained to do. And so having a physician spend hours at the end of the day on a computer logging notes and all the things that we require them to do now to get paid is frustrating. And it does lead to dissatisfaction in your job and frustration and burnout. So I think that the technologies that have been effective in helping the problem are those that let physicians do what they are meant to do, which is treat patients and give more face-to-face patient time. That's number one. And, Arista is focused on how can we get providers to not only do what they train to do, but really to let everyone in the healthcare system operate at the top of their license. And so sometimes you can best do that by giving them technology tools so that they are handling the most complex, acute cases that are appropriate for their licensure. That's just one example.
I like your answer because the easy answer is technology is the answer. It's the way to alleviate these stresses on our provider community. But oftentimes it's the source of some frustration. I had Carly Falk on the show a couple months ago. She's over at Notable. She's the head of research, and she had done a study on this. And what she had come down to was, on average, it was something like 20% of the time that the healthcare professional was in the room with the patient, only about 20% of that time was devoted to the actual patient engagement.
Yeah.
They were preoccupied 80% of their time with taking notes and finding information.
Yeah.
And I mean, I think you and I and anybody listening can say, if you're truly passionate about your job, but you're only allowed to do it 20% of the time, that would lead to some frustration.
Absolutely. I mean, our company and our solution is built on a tech underpinning, right? It's a tech solution, but it has a service on top of it. And all we focus on is how we can get providers to interact with the tech less. How can we get them the benefit of our service without them taking time to be face-to-face with our platform all the time? And that goes into how we implement in clinics and how we leverage sort of ancillary staff to help the physicians. But yeah, it's about just getting them to do the good work and not how can we get them into this app and, get them pushing these buttons every day to make them faster. That's not what it's about.
It's almost a patient focus indirectly through the provider experience.
Yeah, absolutely. I mean, that's what it's all about in the end. And I think we can't treat patients to the best of our ability and result in good outcomes until we support providers. They're number one. You've got to support the providers, and what will fall out from there is, great patient care.
So let's talk about the patient a little bit. So physician burnout and staffing shortages, that is a hot topic right now. Right there with those topics is health equity. And there's been a renewed focus on providing the type of access to care for those that may be traditionally underserved. And I'm specifically talking about rural communities because those are the communities that I'm most familiar with. And, in the past, we haven't had the access to the care, maybe even the specialties that we need to maintain and improve our health and our outcomes, just because a lack of access. How have you seen in the rural community digital platforms play a role in health equity?
Yeah. Well, health equity really requires everyone have access to affordable care, that they can get to that care in a timely fashion. Obviously, if you're in a rural setting and you're far away from providers, that is a challenge for anyone living in those, remote districts. But surprisingly, I mean, folks have huge access problems that lead to inequity in urban settings. Sometimes the barrier isn't your location. The barrier might be your health insurance. We see tons of Medicaid patients struggling to get care because so few specialists will even see Medicaid patients. So access is a problem across the board, but I'll use your rural example because it's just, it's a really easy way to make this point that, patients are often distributed around the country in a way that's disproportionate to where the providers are. So whether you do have a local health center and they just don't have enough specialists to support the demand, or they don't have the breadth of specialties, so you might have a cardiology, but there's no rheumatologist in sight, or whether you're just too far, you're literally getting in a car to travel 2 hours to get to a visit, that just creates huge hurdles for patients to overcome to be able to get that initial care. And what happens is patients don't go to the visits then. And so you're seeing, referrals be made and 40% of them not being fulfilled because it is such a pain for the patient just to get to that appointment. And so like transportation is an obvious hurdle. If you live 2 hours away from the specialist that you need to go see and you don't have your own car, then you're going to have to coordinate public transportation, and that's going to take a very long time to get there. But on top of that, when you are taking that much time to go see a provider, you have to take off time from work. And you have to, if you have kids, often arrange childcare. And so all of these barriers just add up. And what happens is a lot of patients out in rural communities are waiting until their conditions just get to the point where they must be addressed. And then they're ending up in the hospital, in the ER. So it's terrible. And I think what technology has been able to do is bridge this geographic divide a bit and try and meet patients where they are, whether that's through a video visit or through what we specialize in, which is more supporting providers to collaborate with each other so that the physician who is closest to the patient can actually execute on the care pathway and doesn't have to require the patient to travel far distances to get that care.
Yeah, really well said. There's a couple things in your answer I want to respond to, but something that you've made me think of here is, oftentimes we look at the cost of care as the premium that we pay every month, the deductible that we have, or the co-insurance that we have to pay for the visit. But in reality, the cost of care includes time off of work. It includes gas or public transportation to and from the appointment. It includes the child care that you have to arrange. And when you look at the total cost of care in a traditional setting, it's a huge deterrent for certain populations, no matter where they live.
Yeah, it absolutely is. So when we work with partners in rural clinics, for example, we're focused on helping match providers to the right side of care. And a lot of times that means staying at their primary care site and allowing us to connect their primary care provider to a specialist where they can talk about the case and then treat the patient. And it's able to resolve the need for so many referrals where you're getting patients just immediate care with a specialist kind of weighing in on it. But what we do at the end of every month is we send reports back to our providers so they can track all of the cost savings and all of the patient impact. And one of the metrics we include is just miles saved and gas dollars saved. And those numbers are gigantic. Like you wouldn't believe how much those add up. So yeah, to your point, it's not just, the immediate cost of care and the premium and the visits and so on. It's everything else that has to go into getting patients to that care and to actually execute on the pathway that's recommended.
I didn't know that about Arista MD. So I'm glad you shared that because that's a huge benefit. And I think it goes back to showing the value for the provider and for the patient and how those two things have to align to provide the best or the highest level of care. And then on top of that, you're touching on something, that the value-based care model that is becoming more and more popular nowadays to deliver that second visit or that specialty access to that specialty appointment or clinician right there in that initial appointment. Those 40% of referrals that fall off the map, typically, you're closing that gap, but you're improving the healthcare of that patient right then and there, which aligns with the value-based model that we're seeing more and more of now.
Yeah, absolutely. And I'll say it right here. I'm a huge supporter of value-based care. So the more that we can accelerate providers along that trajectory, I think it just benefits the whole system. We so badly need to shift from this, pay for service and procedures to actually paying for outcomes and quality. What we help providers do is um, and primary care providers in particular, is to effectively coordinate care. So a lot of the focus at Arista is how do we empower primary care providers to truly be the quarterback of care for their patients. This has been proven over and over to lead to better patient outcomes, but it also results in much lower healthcare spend. So if you're going into any value-based arrangements, you need to be focused on investing in primary care and giving them the tools that they need to deliver that quality care in a cost-effective way. It's amazing to me because we're very underinvested in primary care in this country. We spend of the 4.3 or so trillion dollars we spend in healthcare, only about I think it's 6-7% is actually going to primary care. And again, those clinics are the champions for the patient. They are moving them throughout the system. So we are only spending about 6-7% of our overall healthcare dollars on primary care. However, the decisions that are made out of that clinic actually influence, they say, over 90% of healthcare spend in the country. So they're doing that every time they make a decision about where to refer a patient or what the testing is going to look like, imaging, all of that stuff. That is where the big dollars come from. And all of that starts with the decisions you make out of primary care. That's really important to give them the tools they need to make those decisions effectively, right?
Yeah, and it's intuitive. I mean, when you think about your personal experiences outside of healthcare, right? Let's say you have a problem with your cable television and you call your provider, and if you can't get an answer from the first person you talk to, and then they transfer you, and you can't get an answer, they transfer you again. Think about how dissatisfying that experience is, and you're just sitting there on the phone. That's just multiplied exponentially in a healthcare setting. When you go to your primary care physician, and then they have to refer you to a specialist, that it may be a few weeks before you get to go see that person, if you ever show up, because of all the total cost of care that we just talked about. And so if we can provide an opportunity for our healthcare professionals, our primary care physicians, to use this term, I'll use this term loosely, but a first call, provide an opportunity for a first call resolution, where in that initial visit, by connecting them to the specialist through telemedicine and virtual care. Think about the impact that could have on the experience of the patient, but also the outcomes of the patient, and just relate it to your personal life and any other industry about how frustrating it can be not to get the answers you need when you need it.
Oh, I'm living this right now, literally in real time. I can tell you this story from like yesterday. We were at the dermatologist, so I can tell you that it impacts everybody, even those who are super sophisticated about the healthcare system. We still find these major bottlenecks. So I have a daughter who's away at school right now, and she has a history of getting a lot of rashes. But about 3 weeks ago, right before finals, poor girl, she developed this rash, and it started on her stomach, and then it started to spread. She went to her healthcare center on campus, and they didn't know what to do with it, had no idea what to prescribe her, and tried to get her a dermatologist visit, but her campus is nowhere near great access to dermatologists, so that didn't work. I tried to get her San Diego dermatologist to do a video visit. They responded by sending us, I'm not kidding, this huge packet of paperwork. And they said, well, first you got to sign all these telehealth consents. And they said, by the way, when's her spring break? Because I think by the time we process all this paperwork and figure out how to do a video visit, you might as well just do it over spring break. Fast forward, she finally did come home. So we were at the derm yesterday. She just got home for spring break. It's been 3 weeks. The rash has now spread all over her trunk. It's going to her arms, her legs, and even on her face. It's now a horrible rash. They were so concerned they wanted to do a biopsy. All of this, so additional cost, horrible outcome for my daughter. And they did know what to prescribe her, but this prescription could have come 3 weeks ago. So if her health center had had access to something like an e-consult where they could have just taken pictures of a rash, sent it to a dermatologist to virtually just look at the pictures, tell them what to prescribe, she could have been on this medication 3 weeks ago and it would have stopped all of this spread. It would have removed the need for a biopsy. So you can just see how important it is that we not make patients wait around to get care. I wish everybody had tools like that today. It needs to be more widespread because, like I said, even video visits aren't necessarily solving the problem. You kind of need all the tools.
You're right. Well, first of all, I hope your daughter's okay, and
Thank you.
sounds like it's starting to get under control and get treated. But that story, everybody has an example like that, a story like that, and I think we in healthcare understand that's not ideal. But there's been so many things in our way of bringing the experience that we get in other industries to healthcare because of regulations, because of compliance, because of privacy concerns, which are all valid. But it has prohibited the technological advances to be implemented and adopted widely across the country so that the patients get the care they need when they need it.
Yeah. Well, and it's change management because back to your first question of the podcast, I mean, providers have had a little bit of a negative early experience with technology. So even some of these fabulous interventions that do leverage technology could have a huge impact. Sometimes you have to overcome a big perceived negative connotation of some of these solutions. So it's change management. It's working with providers to show them that you're going to empower them and support them, not try and disrupt what they've been doing. And that takes time. So we've been doing our e-consults with providers now for about 7 years. And over that period of time, I've seen a big change in the receptivity for these sort of solutions. But every time we work with a clinic, there's an adoption curve. And you have to sort of show the positive impacts that can come from changing your behavior a little bit. And that reinforces itself and starts to build, but it's not a quick process.
Yeah, change of behavior is the hardest thing to do, especially when, these primary care physicians, these healthcare professionals in general, they were trained, they went to school for a long time to learn their trade. They weren't taught these things in school, right? And so now they have to adopt something, learn something that's totally new to them. And that while managing a huge patient, volume and all the other stresses that come with being a healthcare professional. So it's not easy for them, and changing that behavior is a challenge. But when you start to show the benefits, like it sounds like you and others have, you can start opening eyes, and that light bulb moment can start to happen more often.
Yeah, certain physicians have not had an easy time, especially the last few years. I mean, the burden that they've taken on throughout, obviously, the pandemic, but even now they're still recovering. I mean, there's been obviously huge staff shortages. People are leaving. So much turnover at the clinic level, at the health system level. It's a lot. And so we have to work with providers and see where they're at and what they're able to take on at any point in time. We've kind of tried to get creative in working with providers. So we've got this tech solution. It's really easy to use. It actually doesn't take a lot of time to leverage our tools, but sometimes it's just too much. So we ended up introducing a service that kind of complements the tech platform. It basically is a team of nurses that work with our company that become an extension of the clinic. So we'll get them remote logins to the EHR at the clinics we work with. And what we say to the provider is, look, when you're ready, we'll teach you how to use this platform. But until then, we're going to get you the benefit of doing an e-consult, and our nurses are going to do all the legwork. So just submit a referral. And if it's appropriate to collaborate with a specialist on this case, our nurses will do all the legwork to put the information in the platform, get the response back. And that's helped a lot. So the clinics who are totally overwhelmed and have had all the turnover and so on, and just don't even want to deal with training providers on something new, can start getting the benefit of this tool, even without getting into the platform themselves. And that's been a nice a nice way to get folks started.
Yeah, we talk about, virtual care, meeting the patient where they are. What you just touched on in a lot of ways is meeting the provider where they are also, and helping them crawl before they walk and run by giving them the support through your services piece.
Yeah, that's what we're trying to do. Absolutely.
I also like the term that you've used, e-consult. I think traditionally when we hear virtual health or virtual care, telemedicine, we immediately think of a FaceTime experience between the patient and the provider, but there's more to it than that, right? Tell us a little bit, and you talked about, the possibility of taking pictures of a rash and sharing those with a specialist. Tell us, what other ways we can use, virtual health or a digital platform other than just this FaceTime experience.
Yeah, I think you're right. Most people, when they think of telehealth or virtual health, it's all about patient-facing engagement. So a text visit with a patient or a video visit with a patient. But in reality, there are about, I think, 25 million referrals to specialists that happen every year from primary care that really could have been resolved if the primary care provider could have just consulted with the specialist on the case separate from the patient. So you don't even need to put any burden on the patient to be a part of this process. So the derm example's very straightforward. A patient comes in with a rash. When they're in there, you take a few pictures of what's going on, and you can submit it through our platform with anything else that would be helpful. So if you've run labs and you want to include lab results, or you have some clinical background that would be helpful for a specialist to know, we'll take all that information, package it up in the platform, and we'll assign it to an on-call specialist. So in this case, we'd assign it to an on-call dermatologist who would review the images and anything else, and they will write back a very detailed recommendation to the primary care provider as to what they think they should do next with the patient. And sometimes they'll say, yeah, the patient needs to go face-to-face, and they should be seen by a dermatologist in person, but that's a minority of cases. 70-75% of the time when we're doing what we call an e-consult, the information that the primary care provider is getting back is plenty to start executing on a treatment pathway immediately. So within hours, they're armed with this information that they need to start treating the patient.
And that's so powerful for the outcome later on, the speed at which they can operate. So we've talked a lot about, the virtual health options, but let's take that out of it. Let's say worst case scenario, virtual health or an e-consult is unavailable.
Mm-hmm.
What goes into care coordination and communication between a PCP and a specialist if virtual health isn't provided? Talk us through those bottlenecks.
Yeah. And in most cases, sadly today, there's no communication. I mean, we all laugh about this. It's been said many times, but we're the only industry left that uses fax as our main mode of communication between providers. What is going on? We're in the dark ages. So in most cases, when a patient needs to be passed on to another setting of care, so sent to a dermatologist or whatever it may be, their providers are kicking off a fax to that clinic. That's a one-way exchange. There is no back and forth. There's no collaboration. There's no easy way to move over patient records so that the specialist that's seeing the patient has the full background. And there's no way, once that patient is seen by the specialist, for the primary care provider to know what happened. So it's really creating huge fragmentation in care, which is terrible for patients. And it's just clunky. And so it's kind of a mess. The other thing is, when you kick off a referral, most people, and this is not a joke because we work with hundreds of clinics, they are figuring out who to refer to by sticky notes stuck to the monitor of their computer. It's like, oh, we go to Dr. Jones for cardiology, and Dr. Smith, who was in residency with Dr. Ames, is the guy we do for orthopedics. So it's not driven by what they actually are great at, what type of cases they excel at, what quality data is around their performance. It's not driven by who's in network for the patient or even where the patient lives. Is it convenient for the patient? So that's very broken. And obviously, when you have these referrals for patients to a provider that's not in their network, that's far from their home, you have issues with them fulfilling those visits, as we already kind of discussed those hurdles. So that's what the world looks like without great referral tools.
You know what I've always laughed about is, the defense of the fax machine. Well, it's secure and I always kind of smile at that and go, is it, really? Because anybody could walk over the fax machine and pick up something that, isn't theirs and that maybe they shouldn't see. And so, the fax machine has strong staying power and the referral management part of our business, of our industry. But some of the things that have kept it around, I think are still iffy at best, like the security concern that most people have. And that's why they choose fax over, digital engagement, which is always funny to me.
Yeah, very outdated perspective on that. But the other thing I was going to say is it's just hard to, even if you can send a fax relatively easily, how do you track all of the referrals you've been sent? How do you track the progress? Who's been scheduled? Who's been seen? Who needs more information? How are you doing that? So it's not only important that we find a way to help show who a patient should go to, and then help that order be made in an efficient way, but we need a way to track it. And we need to be able to, again, let the primary care provider stay at the helm when they're coordinating care from their patient. And that means post-visit. I need to know the information so I know what we're doing next. I need to put the records back in their file and make sure that all the other specialists that they're seeing are aware that they might be on a new med or under a new protocol.
All the things that go into care coordination, right?
Yeah.
Are lost if not coordinated correctly. So yeah, I think we agree there. And we're getting there, right? I mean, if you look at the last 10 years compared to where we are now, it doesn't take a prophet to look, a few years into the future and see where we're going. But if you could, in your experience, let's take a look. If we're on this open road journey to an ideal state of the union, if you could look a few years down the road, when these things are starting to be adopted and implemented more consistently around the country, where do you see this going over the next few years? What do you see the next 5 years looking like for our patients and our provider community?
Well, a goal for me over the next 5 years would just be to ensure that every patient is matched to the right provider in the right place, in the right setting, and that they're getting care in the most cost-effective way. So sometimes that care might come through an e-consult to their provider. Sometimes that care might come through a video visit or sometimes in person. But let's use all the tools in the toolkit so that that patient triage is happening effectively. That's just number one for me, because unfortunately we have a huge provider shortage. I mean, we literally don't have enough doctors to support our big aging population. And so wait times that are already extremely long for a lot of patients are just going to get longer. And the only way that we can start to address that is by using all these tools and really precisely matching patients to where they should be treated most effectively. So that's number one. And I think if we do that, so much good is going to fall out from it, because when you shrink the wait times, when you're getting patients more affordable care, they're going to follow through with those visits. They're going to see a reduction in disease progression that's happening when they're sitting on wait lists, and all of it starts to fall out. Obviously, it's going to save money as well.
I've got a question for you that I hope doesn't put you too much on the spot, but we talk about it taking a village to get where we want to go. The patient has to do their part. The provider has to do their part. We have insurance companies, the payer has to do their part. And, government legislation, regulation has to be involved along the way to make this effective. In your opinion, of those groups, patient, provider, payer, government, who has the biggest lever that could be pulled to speed up the adoption, the utilization of these digital platforms that will improve outcomes and get us to a place where we want to be?
Yeah, so I can't speak broadly across all digital applications. I think there's too different, right? And that answer I would change depending on the solution. I can speak for e-consults and tell you that they're all extremely important. You actually can't make progress without each of those stakeholders moving from where they have been. what we started with early on was the payer side, because what we realized is that this solution, being able to empower primary care providers to treat a much wider variety of cases and removing so many unnecessary specialty visits, was going to save millions and millions of dollars. And so you have to just follow the dollars really to make this a sustainable intervention. And we thought, okay, if we start implementing this at provider clinics, who's benefiting? Well, the health plan is hugely benefiting anytime we deploy this at a clinic. So our early work was to try and get widespread payer reimbursement. And it took a very long time, but over the course of, since we've been on the market in 2015, we've now been able to move, and Medicare now broadly reimburses e-consults. Arista has national contracts with the big payers. And we are able, in most cases, to go to providers and to give them access to this tool for free or highly subsidized by the health plan, because they are going to yield that initial economic ROI. So that was building block number one for us. Now that we have strong reimbursement in place, it's just a matter of getting it in people's hands. And providers, like I said, they're open to it, but it's just a change management process to get that adoption up to what we know it could be.
That makes sense to me. You know, I started my career in healthcare in the revenue cycle space, and there it's all about margin, right? It's about billing and collecting efficiently, effectively, accurately, and timely. And what we often heard was, if there's no margin, there's no mission. And for these advancements, these technological innovations to have a place in the healthcare setting, there has to be a margin for a provider to implement. And oftentimes, just because of the model that we're in, it's the health plan, it's the payer that has the purse strings, right? That holds the purse strings. And so the value that you provide to them has to be enough for them to then pay and subsidize the bill, the account, for the patient and the provider. And so that flow makes perfect sense to me. And I couldn't agree more with that answer. I appreciate you sharing. Tell me, and our listeners, we've talked about a lot. If you can narrow it down to one thing that you want our listeners to walk away understanding, you know, if they only remember one thing from our conversation, what would that one thing be?
Question your provider before they pass you on. So if you need care outside the primary care walls, really ask the questions. Even if your provider doesn't have a technology platform that can give them all of the information about who the very best provider is for you, and if they don't have access to e-consults, you should pressure them to at least answer some basics. Can you help me find a provider who's close to me? Can you help me ensure that this provider is in network? Can you at least direct me to people who can help me in that process? Because showing up at an appointment after having taken time off work and all of the things we discussed, only to find out that you're not in network with that provider and you're going to have to reschedule, is so frustrating. And this is how people get in the position of watching them get sicker and ending up in the ED. So until our providers are routinely using all of these tools, just start asking the question, I think. And that's a good start.
And that goes back to, you know, as a patient, having some responsibility, being as educated as you can be, and asking those questions. That'll lead to the provider looking into understanding what tools are out there for them to leverage. And then it's a domino effect from there. That'll improve the outcomes and get us where we want to be as a population.
Absolutely.
Well, I can't thank you enough for being here. And I know our listeners will appreciate your explanations on some of these topics. And I think you touched on some of the biggest things that we're seeing in healthcare, and which will be a big part of every conversation over the next few years, so that our providers get what they need, so that they can deliver the services, the care that our patients need. And so this conversation has been very, very valuable. I appreciate your time.
Oh, thanks so much. This has been fun. It's my favorite topic, like I said. So I really appreciate you having me on.
Well, thank you again. You're welcome back anytime. Thanks, everybody.